Imagine this. Your normally energetic dog is suddenly, well, lagging on walks, maybe looking stiff after naps, or perhaps even finding it hard to pick up their favorite toy.
Yeah.
Our minds might jump to arthritis or maybe a pulled muscle, but today on the deep dive, we're exploring a less obvious culprit behind these kinds of issues in animals. Endocrine non-inflammatory myopathy.
Exactly. And that's a bit of a mouthful, but essentially we're talking about muscle problems that aren't caused by infection or inflammation, those common triggers we usually think of first.
Right.
Instead, the root cause is actually an imbalance of hormones produced by vital glands like, the thyroid and the adrenal glands.
Okay, let's unpack this a bit.
Yeah.
We've been digging into excerpts from endocrine non-inflammatory myopathy in animals, and our goal for you today, the learner, is to really understand how these hormonal imbalances can mess with your animal's muscle health. We want to highlight the key things to look out for and get a sense of the prognosis, what the future might hold. We're aiming for clear insights, not confusing jargon, into this really fascinating area.
And it is fascinating. What's interesting right away is that several different endocrine disorders, endocrinopathies, can actually manifest as muscle problems.
Oh, really? Not just one?
No, the source points out a few key ones. Hypothyroidism, that's an underactive thyroid. Hyperthyroidism, which is overactive. Hypoadrenocorticism.
Okay, that's underactive adrenals.
Yep, Addison's disease, often. Then hyperadrenocorticism, or Cushing's, and even, interestingly, the use of steroid medications, what we call exogenous corticosteroids.
Wow, okay. So it's not just one specific gland going haywire that can affect muscles. It sounds like a whole interconnected system can potentially cause issues. How exactly do these hormonal shifts disrupt normal muscle function?
Well, broadly speaking, these fluctuations in hormones interfere with the normal metabolic processes within the muscle tissue itself. Muscles need this really precise balance of energy production and the ongoing maintenance of their protein structure to work properly.
Makes sense.
And when hormones are out of whack, these crucial processes can just be thrown into disarray.
Okay, let's maybe zero in on the adrenal glands first. The source talks about how both too much and too little adrenal activity can have consequences for muscles. So, starting with too much hyperadrenocorticism, Cushing's, like you said, and also muscle issues from steroid meds. What's the link there?
Right. So, in situations where there's an excess of glucocorticoids, these are steroid hormones, whether the body's making too much itself or it's being given as medication.
Like prednisone.
Exactly, like prednisone.
Right.
We see a disruption in how the body handles muscle proteins. Basically, the body starts breaking down essential muscle proteins faster than it can rebuild them.
Oof. That sounds like a pretty direct route to muscle weakness then. And I think the source also mentions something about carbohydrate metabolism, maybe insulin resistance.
You got it. An excess of glucocorticoids can interfere with how the body uses carbohydrates for energy, and that can indeed lead to insulin resistance. The source also notes that sometimes in hyperadrenocorticism, you might see elevated levels of ACTH. That's the hormone that tells the adrenal glands to work harder.
And this detail really jumped out at me from the source. Dogs seem particularly sensitive to these corticosteroid effects. It said prolonged use can commonly lead to muscle atrophy, especially in the masticatory muscles, the chewing ones.
Yes, exactly. That's a key point. The chewing muscles in dogs can be very noticeably affected by long-term steroid use. An owner might notice their dog dropping food more, maybe, which seems small but could be significant.
And it even said steroid-related muscle issues are pretty common in animals generally. What would a vet actually see if they looked at the muscle tissue?
Pathologically, muscle biopsies in these cases often show what's called selective atrophy of the type 2 muscle fibers.
Type 2.
Yeah, think of muscles having different fiber types for different jobs. Type 2 are often the fast twitch fibers for quick bursts of activity. Those seem to be primarily affected here. The source mentions pathologists might even see things called lobulated or ragged red fibers, maybe even with myotonia.
Myotonia, is that like stiffness?
It's a prolonged contraction, difficulty relaxing the muscle after it's been used.
Okay, so that covers the too much steroid side.
Yeah.
What about the flip side? When there isn't enough adrenal hormone, hypoadrenocorticism, Addison's disease, how does that hit the muscles?
Well, when there's a deficiency in those crucial adrenal hormones, it can trigger a whole cascade of problems. You can get circulatory issues, problems with fluid and electrolyte balance, which is critical for muscle function, and again, a disruption in how the body metabolizes carbs.
So multiple hits on the system.
Exactly. All these things can negatively impact how muscles work.
And the source mentioned something that seemed a bit odd, that the pathological findings, like under the microscope,
Hmm.
are often normal. How could that be if the animal is weak?
Yeah, that is surprising, isn't it? But it's an important point. In hypodrenocorticism, the changes within the muscle cells might not be as obvious or dramatic as with too much steroid. The impact seems to be more systemic, affecting the overall environment the muscles operate in, rather than causing distinct structural changes you can easily see in a biopsy.
Interesting. Okay, so bringing it back to what an owner or vet might actually observe, the source notes weakness in dogs with both too much and too little adrenal activity, right? And also the steroid myopathy in dogs of any age. So weakness seems like a real common thread with adrenal issues.
That's a key takeaway, absolutely. Weakness is a big flag. Now, should we shift focus to the thyroid gland?
Yeah, let's do that. Because just like the adrenals, the source says both an overactive and an underactive thyroid can cause muscle problems.
Yeah.
Let's start with hyperthyroidism, thyroid in overdrive. And I know that's seen more often in cats, correct. The source specifically mentions weakness in cats. So what's going on at the muscle level there?
With hyperthyroidism, the body's whole metabolism is just ramped way up.
Like everything's working too hard.
Kind of, yeah. This leads to increased activity in the mitochondria, the energy factories in the cells. It accelerates the breakdown of proteins and fats. It depletes glycogen stores.
That's the muscle's energy reserve.
Exactly. And it even impairs how the muscles take up glucose. So all of this puts a huge strain on the muscle's ability to function efficiently.
So it's like they're being forced to sprint a marathon without enough fuel or repair crews.
That's a pretty good analogy, actually. And interestingly, what about those muscle biopsies in hyperthyroid cats? The source says they're often normal too. Another surprise.
Again, so similar to the low adrenal function.
Seems so. The weakness might not always correlate with obvious microscopic changes in the muscle fiber itself. It's more about that metabolic chaos affecting performance.
Okay, let's flip to hypothyroidism then, the underactive thyroid. The source links this with weakness in dogs. How does a sluggish thyroid affect muscle health?
An underactive thyroid basically slows down muscle energy metabolism. It impairs the body's ability to break down glycogen for energy, to make new glucose, and just generally carry out those essential energy-producing processes efficiently.
Like the metabolic rate drops.
Exactly. And it also messes with how insulin helps get carbohydrates into the muscles for energy. Think of the thyroid as like the body's thermostat and energy regulator. When it's running low, the furnace isn't burning fuel efficiently, and the muscles just don't get the power they need.
So they're constantly running on low battery, essentially.
Pretty much. It's a systemic slowdown that directly impacts muscle power.
And the pathological findings in hypothyroid dogs sound a bit different based on the source.
Yes, they do. Here, biopsies do often show changes. You might see that type 2 muscle fiber atrophy, again, similar to the steroid issue, but the reason behind it is different.
Yep.
You might also see an increase in type 1 fibers, and sometimes very specific microscopic things. They're called PAS-positive deposits and nymmaline rod bodies, little structural changes.
Right, so more distinct fingerprints in the muscle tissue itself with hypothyroidism.
Exactly. Those can be clues for the pathologist.
Okay, so we've touched on the main endocrine culprits, adrenals, thyroid, steroid meds. What are some of the general signs that might make someone suspect an endocrine myopathy overall? What history clues?
History is super important. Things like muscle weakness, obviously, noticeable muscle loss or wasting atrophy, and stiffness. Those are really key.
Stiffness, okay.
But the source also highlights things you might not immediately connect to muscles, like regurgitation.
Bringing food back up.
Yeah, undigested.
Oh.
And difficulty swallowing, which is dysphagia, or even changes in their bark or meow dysphonia.
Wow, voice changes too. Those are definitely concerning signs. What might a vet then find during the physical exam?
Well, on exam, they'll likely confirm that muscle weakness, maybe find stiffness, possibly muscle cramping, or the animal might seem painful when muscles are touched. That's myalgia. It's also possible to see either muscle enlargement hypertrophy or that wasting away atrophy. But here's a really crucial point the source emphasizes. Other classic signs of the underlying endocrine disease, like maybe the excessive drinking and urinating with Cushing's, or the skin changes with hypothyroidism, they might not be present.
Ah, so the muscle issue could be the main thing you see, or even the only thing.
It could be, and that can make diagnosis pretty tricky. You might not immediately think hormone problem.
That makes total sense if it's not the textbook presentation. So how do vets actually pin down a diagnosis of endocrine myopathy? And importantly, tell it apart from other things, like inflammatory muscle diseases?
Muscle biopsy really is the gold standard here for telling the difference. Endocrine myopathies are non-inflammatory, whereas others involve inflammation. And the source is really specific. You need a technique called fiber typing, done on fresh frozen sections of the muscle biopsy. That's vital. Standard processing, like putting it in paraffin wax, apparently won't give the detail needed.
So not just any biopsy, but a specific type of preparation and analysis.
Mm.
Got it. What other tests help?
Well, the initial stuff, routine blood work, a urinalysis, those might show abnormalities that kind of point towards an underlying endocrine disorder, like changes in electrolytes or glucose or liver enzymes maybe.
Okay.
Interestingly, the source notes that creatine kinase, or CK, an enzyme that often spikes with muscle damage, is usually normal or only mildly up in these endocrine cases.
Well, that's useful. So normal CK doesn't rule it out.
Exactly. And then, of course, you need those specific hormone tests, thyroid function tests, adrenal function tests like ACTH stimulation or dexamethasone suppression to actually identify the specific hormonal imbalance.
Makes sense. What about imaging or any other specialized tests?
Imaging can be useful if there's regurgitation or trouble swallowing. Maybe dynamic studies like a video X-ray while swallowing barium can help evaluate that.
Uh-huh.
And a cardiac evaluation, an echocardiogram, might be recommended for hyperthyroid caps because that condition can affect the heart muscle too. Sometimes electromyography or EMG, which measures electrical activity in muscles, can add information.
Okay, so quite a diagnostic toolkit potentially. Let's say a diagnosis is made. Now, what about treatment? And, what can pet owners expect for recovery?
The absolute number one thing is that treatment focuses entirely on fixing the underlying endocrine disorder. Treat the hypothyroidism, treat the Cushing's, manage the Addisons.
Right, treat the cause.
Precisely. Now, for the steroid-induced muscle issues, the strategy is usually to carefully reduce the corticosteroid dose. Get it down to the lowest effective level if possible. Maybe switch to a different type of steroid.
Like one less likely to cause problems.
Exactly. The source mentions non-fluorinated options are generally better, and maybe giving the medication every other day instead of daily can help sometimes.
Okay.
The source also mentions a supplement, L-carnitine, might potentially help if there's abnormal fat buildup inside the muscle fibers, and it specifically calls out certain steroids, triamcinolone, betamethasone, dexamethasone, as being more likely to cause muscle weakness. Good to keep in mind.
That is really important info for anyone whose pet is on long-term steroids. What about other supportive things, like physical therapy?
Yeah, physical therapy can be really helpful. It can help manage any musculoskeletal issues like stiffness or range of motion problems, and it can help prevent or treat muscle loss, especially in dogs getting glucocorticoids.
Good to know. And diet, if they're having trouble swallowing.
Diet management is key for those cases, yeah.
Yeah.
Simple things like raising the food bowl can help sometimes. Changing the food texture may be softer or formed into meatballs. Or, in severe cases where they just can't eat enough safely, a temporary feeding tube, like one going into the stomach, might be needed.
Okay. And now, the big question, I guess. What's the outlook, the prognosis for these animals?
It really varies depending on the specific condition. That myotonia, the muscle stiffness with hyperadrenocorticism, the source says the prognosis for that resolving completely is unfortunately poor.
Oh, okay.
But for steroid myopathy, the muscle weakness itself generally has a good prognosis for strength and mass coming back once the steroid situation is managed. It just might take several weeks.
That's encouraging. What about the thyroid ones?
For hypothyroid myopathy in dogs, improvement in the muscle pain and stiffness is common once they get on thyroid medication. And for hyperthyroid cats, the prognosis for regaining muscle strength is good once those thyroid levels normalize with treatment.
Good. And Addison's?
Hyperdrenocorticism also generally a good prognosis for muscle strength returning with proper treatment, and those swallowing issues, the dysphagia and regurgitation, they may resolve as the underlying endocrine disorder gets under control.
Okay, so a lot depends on the specific cause, but there's definitely hope for improvement in many cases once you identify and treat the root problem.
Absolutely.
So the key takeaway here for you, the learner, seems to be that these hormone imbalances can really pack a punch when it comes to muscle health in our pets. They can cause a pretty wide range of signs, some obvious, some less so. And getting that accurate diagnosis, which often means specialized tests like that specific type of muscle biopsy, is just crucial for figuring out the best treatment plan.
It really is. And, this raises a really interesting point to mull over. Given this really complex link between hormones and muscles, What other symptoms in our pets, things that seem totally unrelated, might actually have an endocrine basis deep down?
That's a great question. It's a good reminder to always look at the whole picture, isn't it? And
Yeah,
really talk through all the changes you see with your vet.
definitely. Keep those communication lines open.
Absolutely. Well, if you found this deep dive into endocrine non-inflammatory myopathy interesting, we definitely encourage you to explore the specifics of each of these endocrine disorders and their many manifestations further. There's always more to learn about the complex inner workings of our amazing animal companions.